In this video, we are going to cover flowcharts and tables from the topic of mitral stenosis. So starting with table 1, the major causes of mitral stenosis. So the most common cause of MS in India is rheumatic fever, followed by rheumatic fever and only rheumatic fever. Apart from this, the other causes could be congenital like the parachute valve or cor triatriatum or the severe mitral annular calcification with leaflet involvement, or connective tissue disorder like SLE or rheumatoid arthritis, or it could be because of some mass kind of lesion seen in myxoma or infective endocarditis where there is obstruction of the mitral valve. Now talking about the severity of MS. So here you only need to focus on the severe MS part, and the rest of the other thing you could just forget. Okay. So the severe MS, the valve area is less than 1 centimeter square, and the mean gradient in between the left atrium and left ventricle is more than 10 mm of mercury, and the pulmonary artery systolic pressure is more than 50 mm of mercury. It is because in chronic mitral stenosis, because the valve is closed, that is why the left atrium expands, the size of the left atrium increases, and here the pressure also increases, and because of increase in the pressure in left atrium, this pressure is transferred in the pulmonary artery, and because of which the pressure in the pulmonary artery increases. So if the pressure is more than 50 mm of mercury, it means the patient is having severe pulmonary artery systolic pressure and severe MS. Then talking about the mild and moderate cases, in mild the valve area is more than 1.5 centimeter square, in moderate it is 1 to 1.5 centimeter square, and mean gradient here is less than 5 mm of mercury, here it is 5 to 10. In mild the PASP is less than 30, and in moderate it is 30 to 50 mm of mercury. So in this only remember the severe MS findings. Now coming to staging part. So in all the valvular diseases, the staging is same. Stage A means patient is at risk of developing mitral stenosis. Stage B means progressive MS. The patient could be having mild or moderate MS. Whereas in stage C and D, the criteria of severe MS is fulfilled, but in stage C, the patient is asymptomatic, whereas in stage D, the patient is symptomatic. Now coming to the management part. So here we will divide the patient based on the stages. If the patient is having severe MS, then patient could be in stage C or stage D. And if the patient is having progressive MS, then the patient is in stage B. So if the patient is in stage B, it means the patient is asymptomatic. So why the patient come to us? It is because the patient is having symptoms during exertion. So we will do stress test in that patient. And if in stress test, the patient is hemodynamically significant MS and the valve is having good anatomy, like the valve is pliable, there is no clot, and the mitral regurgitation if present is less than 2 plus, then we can go for percutaneous mitral balloon commissurotomy. Okay, or it is also known as balloon mitral valvotomy. Okay, so for this we also do one score which is known as Wilkins score. Okay, and Wilkins score should be, in this patient the Wilkins score should be less than or equal to 8. This is commonly asked in the Viva, so learn this from your textbook. Okay, and if the patient is having severe MS, then patient could be symptomatic and patient could be asymptomatic. So in the symptomatic patient, if the valve anatomy is good and the Wilkins score is less than 8, then we will go for BMV. Okay, and if the valve anatomy is not good or the Wilkins score is more than or equal to 8, then we will go for mitral valve surgery. As simple as that is. And if the patient is in stage C and the Wilkins score is less than or equal to 8, and the patient is having new onset of atrial fibrillation, or PASP is more than 50 mm of mercury, that is patient is having severe MS, then also we will try to go for balloon mitral valvotomy or PMVC, and if it is not possible, then we will go for mitral valve surgery in this patient.